Hi, I'm Dr. Nick Neneman with Neneman Chiropractic Clinic, and thanks for tuning in for today's video blog. I'll have to apologize, I've been slacking a little bit. I haven't been putting out as many video blogs as I was prior to this past month, but just been really busy around the office, and I mean really that's no excuse. I should be still taking some time to do this, so I want to get back on track with doing these weekly, so that's what I'm going to aim for. If anything, at least bi-weekly. But today's topic, this is something I deal with on a regular basis, and I realized I haven't really done a blog on this yet. But what I want to talk about today is muscle spasm. This is something that I see all the time in my office. What the patient commonly presents with is they'll come in and they're saying they say their back's out, or they'll say that they have a pinched nerve and they can't move. When oftentimes what they're dealing with is muscle spasm. And the way I explain muscle spasm, it's your body actually trying to do a good thing, but it's kind of doing a bad thing. And what I mean by that is muscle spasm is a defense mechanism of your body. I always explain to people that muscles, their job in the body and specifically in the spine is to support the spine and protect it. Your muscles are what hold your spine up and stabilize it. And so muscle spasm has an underlying cause, and what I mean by that is usually what will happen is the facet joint in the spine, which are the hinge joints in the spine, or the nerve root where the nerve roots exit out the spine, or maybe even the disc could be injured. But in one of those three areas, there's inflammation, there's a problem, there's something going on, and so the muscle reads that as a problem, and so it literally seizes up or spasms up to protect that area. So when that patient comes to my office, again, they're usually having some nerve compression, or they're having joint inflammation, or maybe they have a little bit of a disc injury, which could be putting pressure on the nerve. But that problem is causing the muscle to spasm up, as a defensive mechanism. The muscle goes into protective mode. And this spasm muscle is what's causing so much pain and inability to move. So usually when you're having that severe pain, it's usually due to muscle spasm, and that patient will often say, well, I think I just have a muscular problem. Well, again, yeah, you have muscle spasm, but there's an underlying cause of that muscle spasm, and that's a perfect chiropractic case. As a chiropractor, I'm gonna figure out what is that underlying problem, why are these muscles spasming, and it's usually something with the joint and the nerve that can be adjusted, I often tell the frustrating thing with muscle spasm is you're not going to oftentimes get immediate relief. That patient comes in real acute pain and they want to just go sprinting out of the office. And what I tell them is you do need adjusted. The reason you have muscle spasm is you need adjusted, and I'm going to adjust you. But the thing I tell them is the inflammation's not going to immediately go away in 10 seconds. It's going to take time for the body to dissipate the inflammation, but also just for those muscles to calm down. I could adjust an inflamed nerve, a restricted joint, but it could take the rest of the day for those muscles to calm down. It could take a couple days for those muscle spasms to fully calm down. So, and a lot of times too, it can be hard to adjust a patient with muscle spasm. They're so spasmed and locked up and tensed up, it can be really hard to adjust them. Sometimes I'll even tell the patient, let's get you ice in, let's get those muscles to kind of chill out a little bit, then we'll adjust you, So it all depends on the case, but the biggest thing I tell the patient is don't expect to go sprinting out of here, but those muscle spasms will calm down, and let's get you adjusted on a regular basis here, get that area to heal and get the inflammation out of there, and get the nerve to function normal, get the joint to function normal, and you should quit having those spasms. And one thing I'll have happen is the patient, they have the muscle spasm and they want to go and get muscle relaxers from an MD, and the muscle relaxer will calm down the muscle and they feel better and they think they're fine. And the thing I say is, unless you treat that area, you're likely in 2 weeks or a month or 2 months to get those spasms all over again. So you're still a chiropractic case just because that medicine makes you feel better. It's not treating the cause, it's just treating the symptoms. So you still need to get in and see the chiropractor. So thanks for tuning in today. I hope this really clarified muscle spasm. If you're dealing with this, you need to come in and get checked out. So anyway, I hope you have a great rest of the week. Have a great happy Thanksgiving, and tune in next time for our next video blog.